Good afternoon and welcome to the fourth AWP staff briefing. First of all, thank you very much for the feedback from last month. We've taken that on board and hopefully our briefings will continue to improve. There's 4 items in the briefing today. I want to say something about me. I want to talk about our community mental health survey. I want to talk briefly about the money, and I also want to talk about the traumatic stress service for our staff. So if I can start off with me, news may already have reached you that I've decided to leave AWP and our NHS, and I've made an announcement this week to say that I'll be leaving the Trust early in the new year. I have been offered and accepted an opportunity to create and run a mental health service in the state of Qatar, and I'll be joining the Hamad Medical Corporation early next year. So it's with a kind of heavy heart that I announced that I will be leaving AWP. I've had 3 years in the Trust, which I have really enjoyed, and I'm delighted at the progress that we've made during that time. I was reminded, funnily enough, at the Staff Awards ceremony last week, just how committed, how passionate and how caring our staff are. And it always makes a job like mine easier to do when you have such committed staff. So I'd like to thank everybody for the support they've given me over the last 3 years. As I say, I won't be leaving until the new year, and one of the things that I've agreed with the board is that we'll make sure that we maintain the stability of the organisation, we make arrangements to ensure there's an easy transition, and most importantly, we won't lose sight of our priorities, which are around making sure that we get our quality right, making sure that we continue to support our staff, and making sure we live within our means. And the big focus for the next several months will continue to be our ability to demonstrate to the Care Quality Commission just what great care you give. So our priority, of course, will be to try to ensure that our services have a good rating when CQC inspect them early next year. So now some really good news. We've just seen published the CQC's annual Community Mental Health Survey, which takes the views of service users and publishes their views about our services. And we've seen improvements in virtually every aspect of the community services that we provide. So it's a real credit to our localities and to every one of our community teams for the improvements that we've made. And of particular note, in 3 areas, we've actually scored the best in the country. So the efforts that you and your colleagues have made have seen a significant improvement in patient experience and significant improvement in the results, and I think that's a real testimony. So the 2 questions that we scored particularly highly on was around information around medicines, and people were asked, were you given information about medicines? And in the last 12 months, has your NHS mental health worker checked with you about your medicines? And we've scored really highly in that area. We scored well, improved around help with finances and benefits, and again this was the highest score in the country. We've seen real improvements in advice on peer support, and we've also seen improvements around service users knowing who to contact in a crisis, and I think that's pretty critical. And there's also been improvements on helping people with employment and accommodation. And the survey is available for people to read, but I think it's really worth noting the significant improvement that we've made and the particular improvements we've made in some of those areas of high note. I said I'd like to mention the finances, and I don't want to labour the point, but it wouldn't have escaped your notice that the NHS is forecasting a significant deficit at the end of the year. And all of our organisations in the NHS are being asked to find greater ways of making efficiencies and trying to ensure that we live within our means. Now, the areas that we are going to continue to focus on, and I talked about this last month, is around reducing non-clinical costs, trying to make sure that we manage our overheads, we spot any waste and we deal with that. Rostering, making sure we have effective rostering and getting the balance right, as I said last month, between what you can expect and what we need to in terms of providing good care. And we also need to look at caseload management, because although we've made fantastic strides in our community services, as I've just mentioned, we need to look at the volume of service we're offering as well, and make sure that our caseloads are weighted in a way that ensures that they're safe and you're able to support people effectively. So those 3 areas we'll be looking at in some depth to make sure that we can make any contribution we can to ensuring that the NHS, and our trust in particular, lives within its means. And the final thing I wanted to talk about is the new traumatic stress service for staff. Often staff are confronted with incidents and situations that are unexpected, and they will have an impact on staff. We need to find ways of helping staff to cope with that, recognising the trauma it causes and making sure that we support people through that. So the new service that we've established is a confidential therapy service. There are trained therapists there who will support individuals through any traumatic situation. It's open to every single member of staff, and it can be done on a self-referral basis. And I would really want to encourage staff, those of you who have had the misfortune of a traumatic event, to seek help through that service so that we can support you back to full health and ensure that you're able to function in the way that you would wish. So there are the 4 items for the briefing this month. Thank you very much for listening, and as I've said in the past, I would encourage you to ask the directors that are in your room any questions that you have, and by all means to make any comments that can be fed back, and then we can respond to them in next month's briefing. Thank you very much indeed.